Well, hey, it's Cubby and Christine. And Cubby, we are just in love with all the folks over at Hassenfeld Children's Hospital and the incredible work that they do and the beautiful people that we get to meet with this experience and sharing their stories of how Hassenfeld Children's Hospital has made such a big difference in their lives. And one of those people is with us here today, Katy Erdman. Hi, Katy.
Hi, Cubby and Christine. How are you?
Hi.
We're doing great, thank you. We want to hear about you and your son, Alden. Now, you had an experience that had to be pretty frightening a couple of years ago, right?
That's correct. Yeah, I'm happy to be with you here today. My son's 8 months in remission. And so we're still very much with Hassenfeld. We get scans every 3 months and we see our oncology team. And, it's kind of nice to go back now because lots of hugs and hellos and everyone's so excited to see Alden and his full head of hair. And, he's just growing like you would never think he had as much chemotherapy as he did.
Yeah.
A couple of years ago, almost exactly 2 years to the date. It was the night before he was supposed to start kindergarten, and he had been complaining about some stomach pain for a couple of days, and we thought it might be appendicitis, and we just couldn't figure it out. His pediatrician was kind of stumped, and finally we went to NYU pediatric emergency room because it just was getting worse and worse, and it was not appendicitis. It turned out to be a big tumor that had been pushing on his insides. And the next morning, it's kind of all history from there. It was just, we were admitted and we met the head oncologist there, Dr. Rates, and all of the team. And it turned out to be stage 4 neuroblastoma that had spread to his, to his bone marrow. And yeah, so it was very scary.
Oh, wow. And he was how old at that point?
He was 5. So he's 7 now.
Now, he's had so many treatments in the last 2 years. I mean, can you name just a few of the major treatments he's had?
Yeah, so because it had spread from the tumor to his bone marrow, that they're not sure why neuroblastoma does this. It's just, I don't know. It made him stage 4. So they kind of threw the book at him, basically. He had 6 rounds of chemotherapy. He had the tumor removed, which was like a 10-hour surgery. Then he had a dual stem cell transplant, which basically, they give him as much chemotherapy as they possibly can. And then they kind of revive him with his own stem cells. And then the pandemic hit. So COVID kind of hit really hard in the middle of the 2 stem cell transplants. So that even made it more, terrifying because his immune system is basically wiped out. He doesn't have the ability to fight off anything. So when you have this new, killer virus all of a sudden taking over the world, it was pretty insane. But we got through that barely. And then he had radiation for 2 weeks. He had radiation every day for 2 weeks. And then he had 5 months of immunotherapy, which is kind of new in the past 10 years. And the immunotherapy, it gives such better prognosis than it used to be a much worse prognosis, this illness. And so that was about 16 months, just back to back. And like I said, the added insanity of a COVID pandemic was just something you could not think would ever become your life,
Yeah, what an incredible journey. I'm so glad you're surrounded by great supportive people who are helping you guys through it. How is Alden doing now?
He's doing great. He's starting 2nd grade in a few weeks. And I think he had his age going for him. I mean, as a 5-year-old, it was just very, I don't know, matter of fact. Like there wasn't a lot of emotions or pushback from him. Like, well, why is it, why do I have to do this? Why, it was just very much like, well, this, you have cancer. We have to get rid of it. This is what's going to happen. And he just kind of went along with it in a way. It wasn't like a 16-year-old who would be like, hell no, get me out of there.
Right.
Running from the needles and the, everything that they were giving him. It was it was hard for us in a way because he doesn't really have any rights in a way. It's just like, I don't know. I know an adult who just got diagnosed and, she has the right to say, well, I'm not actually going to go through treatment. I'm going to do these other things, which is silly, of course, but it's her own body. So anyway, for us, it was kind of, I don't know, that was kind of a funny part of it. But he's doing great.
I just feel there's so much on you as parents, and
yeah, exactly.
You're giving and doing the best thing that you can, bringing him to Hassenfeld. I think, an incredibly wonderful choice, the best situation you could be in.
Oh yeah, absolutely. And we did get second opinions at Sloan Kettering and CHOP, and actually our oncologist, Dr. Rates, who I think of as family. I mean, all of them there are just everybody, the whole team there, the nurses, the oncologists, the infectious disease doctors, the ICU doctors, the clinic doctors, the child life specialists, the therapists, they're our family. I mean, we spent so many months with them, and I mean, because he was inpatient basically for 16 months. And you just kind of create these relationships. And I mean, they saved my little boy's life. I mean, he's not out of the woods yet. They say, it'll be about 5 years by the time you can really breathe easy. He'll stop doing scans after 5 years. But they're very optimistic. A lot of kids will have to stop treatment because they just can't deal with the toxicity. But Alden, he kind of plowed right through it. So I think they're all really impressed with him. And, it was so heavy the whole time, but just the nurses and the child life therapists were there just to kind of, I don't know, make it as fun as possible, and just keeping Alden as happy and comfortable. And every little, he would have to he had a central line, so they would have to access this port to give his medicines and his therapies, and not one access or blood draw or IV placement, or it's like these gnarly things just every day happening to him. But they were there just, with the clown would come in and the therapy dogs. This was pre-COVID. It was like a big party there, just holding his hand, holding our hand, like, hugging. The personal connection with Hassenfeld was beyond any other, I feel like.
Well,
and
you
incredible.
kind of just answered the question I was going to throw out, but I mean, there has to be even more of a reason why people should go to lightfm.com/gogold and support Hassenfeld Children's Hospital right now. Can you tell Light FM listeners why they should do that?
The most loving, best, just empathetic team in the whole world. I mean, beyond saving my little boy's life with all of the, they are world renowned. I think everyone probably knows Hassenfeld is just, I mean, they're just incredible. The team there could not be more supportive, caring, loving, and life-saving.
Oh,
they've got great flat screen TVs with PlayStations. They pull out the works.
it's like being at home, like being at home for the kids.
My when we would go home in between treatments, my son would be like, "Oh, I kind of miss the hospital,"
Yeah,
these loving nurses sneaking him cookies and like letting him play PlayStation up into
Great.
I would feel comfortable leaving to go to work sometimes, and I would leave him there for a couple hours with the nurses there, and they just loved him. They were playing cards with him and games and just keeping it really fun and light, surrounding these horrible, treatments he had to get. They made it okay for him. They made it more than okay for him.
Yeah, they're really wonderful. Cubby and I have seen them in action, and talking to you and hearing Alden's story is just so inspiring. I mean, for all of us.
No, so caring. I mean, my oncologist, Dr. Rates, again, Elizabeth Rates, she's like the director of pediatric medicine in the whole hospital. She's, the chief, and yet she's calling me, like making sure like I'm comfortable, to see if I'm happy with the room that they gave us, to see how Alden can she's always thinking of these creative ways on how to just make it as easy and as, palatable as possible. just next level care. It's just incredible there. Yeah,
Well,
Hassenfeld. If you have to go through it, Hassenfeld is the place to be.
Mhm.
we can't thank you enough for sharing your story, and please give a big hug to Alden for us if you could. And,
Yeah,
and
absolutely. Maybe
we
we'll have another opportunity to come by and say hi one day.
in person.
Yeah,
Absolutely.
if you're continuing the work, I mean, my family and I, we always wanted to give back to Hassenfeld and to help families that are there now. So if there's any other, anything that comes up in the future, just let us know.
Oh, thank you. You're doing it. You're
Yeah.
doing it right now. Thank you so much. Yeah. So there's ways that all of us, because I know I want to help. We all want to do whatever we can. So lightfm.com/go gold is the place to go and support kids like Alden and his beautiful family, Katie. We just can't thank you enough. This was, like I said, very inspiring. He's a strong guy. He inspires all of us.
Yeah, absolutely.
Mm-hmm.
And I think Alden will look forward to helping families that are dealing with pediatric cancer, because it's just something that shouldn't be in our world, but
Yeah.
but
Thank
Hassenfeld, hopefully, in the future.
Great job. Thank you.
All right. Thanks, guys.